So I recently had a question about alcohol. Can I drink on a keto, an intermittent fasting plan? Because after all, it's zero carbs, and I'm not going to do wine or beer. I'm just going to do hard liquor. So even the dietary guidelines by the USDA said that 1 drink a day for women and 2 drinks a day for men. So it can't be that bad. That's pretty much drinking in moderation. And there's probably certain antioxidants in the alcohol, so it shouldn't hurt me too bad, right? Well, let's just take a look at a couple things. Okay, so alcohol, even though certain types of alcohol is zero carbohydrates, it's a solvent. It acts as a poison or a toxin to the liver. It kills liver cells. It kills brain cells. It leads to a fatty liver. In fact, 90 to 100% of alcoholics have a fatty liver. And then that leads to inflammation, and then fibrosis, and then cirrhosis. Once cirrhosis sets in, which is scar tissue on the liver, I think it's going to be not just difficult to reverse that, if not impossible to reverse that. So you don't want to get to that point. But alcohol does deplete vitamins, especially B vitamins. It dehydrates you, and it blocks fat burning. Okay, so it's going to knock you out of fat burning. So let's say, for example, it's a Friday night and you drink. Just kind of realize you're not going to burn fat for at least 48 hours. So the question is, can you drink when you're doing keto? Well, of course you can, as long as you're willing to experience these effects and not burn fat for several days. Hey, you know what? I just wanted to say thank you for watching these videos. You made it this far. I appreciate your attention and your precious time.